Hello, everyone. Today's video is a video that I have been thinking about recording for well, the better part of a year now. Um, One of my very close family members was afflicted with a really severe case of a condition called Guillain-Barre syndrome, or GBS, a little over a year ago. And it was a very long, arduous road to recovery. And thankfully, they're doing much, much, much better now. And so I've been thinking about putting out some information about our experience for several months now. And I'm doing that in part because we had a heck of a time finding resources to help us along the way to help facilitate my family member's recovery. And um, I thought it would be useful to put this out there because I know I would have really enjoyed, would have really, really appreciated having filmed this video during our attempts to find information about this. So this video is about our collective experience, myself and my very close family members' experience, and there are many other family members involved as well. I'm being vague with the language because I don't want to, I have my family members' permission to talk about this, but just don't want to, give it any identifying information just to keep their confidentiality intact. Um, But because I am a clinician, I will just mention that none of this is to be construed as medical advice. This is all for informational purposes only. If you need healthcare advice, please talk to your healthcare provider to get that advice. So I just want to share again our experience so that folks can benefit from it. And my family member, who is an amazing individual for many reasons, not just because they came through in a horrendously difficult medical experience, but also because when I asked them, is it okay if I post a video to get some information out there about this? They were like, yeah, of course. Like, I suffered extremely from this, but if my suffering can, what we learn from, helping me get better can help other people, then they were, all for it. So I have their blessing to post this video, but just keeping everything confidential. So please excuse the roundabout language, but that's the language I'm going to use. The information that I'm talking about here also does relate to other neurological conditions too. So it's a Guillain-Barre syndrome focus, but this information does apply to other neurological conditions too. So if you're watching this video and you're like, oh, there's some other neurodegenerative condition, some autoimmune neurological disorder, there's certainly some spillover here in terms of some of the therapeutic interventions as well. So it's not completely niche to GBS, Guillain-Barre syndrome, but that's the what I'll be talking about today. So just to give a bit of a backdrop. So my family member was well under the age of 25 when this afflicted them. Leading up to that point, they were perfectly healthy, and around middle of October last year in 2024, started getting a bit of loss of sensation in their feet. That started in just a couple of toes, and then each day it kind of got a little bit worse, a little bit worse. We didn't really know what the heck was going on, so after a few days, like, okay, this is getting worse, had like a online telemedicine appointment, and the person, the nurse or whoever we were talking to there was just like, wasn't really concerned about things, just like, oh, just, keep an eye on it. But after a few days, it was like progressing up to the point where their ability to walk was getting compromised. So we like, okay, better go get them checked out. And by that point, I had been doing a bit of research. It's like, I wonder if this is GBS. Like this, I didn't want it to be, right? Of course, you never want it to be GBS, but it's like, I wonder if this is GBS. And sure enough, went into the, emergency department, like, outpatients, waited for, hours because Canadian healthcare system is quite beleaguered to say the least. Yeah, anyways, got in to see a neurologist pretty quickly, who was on call, relatively speaking, saw them like, several hours later that day. And they were like, yeah, this is GBS. So with Guillain-Barre syndrome, just for anyone who's watching this video is probably interested in Guillain-Barre syndrome, but just in case you're not familiar with it and you're just listening to this for educational purposes, Guillain-Barre syndrome is an autoimmune attack on the nervous system. There are several things that can trigger it. Mycoplasma pneumonia, like a bacterial infection, can trigger it. Certain viruses, like Coxsackie virus, can trigger it. COVID has been shown to be able to trigger it. There's a certain bacterial infection in the gut called Campylobacter jejuni, which can trigger it. There's some other viral triggers and things like that as well. And then some cases are just idiopathic. Quite frankly, as we know from our experience, no testing was done to determine what microbe actually caused it because, quite frankly, the doctors don't care, or at least it doesn't matter for treatment, so they don't bother doing diagnostic testing. Although it would have been nice just for our own knowledge, but they didn't do any diagnostic testing to find out where it came from. And so with GBS, some cases are very mild. They just It just causes an attack on the myelin sheath, so the installation of the nerves, if you will. And so folks might get some, loss of sensation, maybe a little bit of motor impairment, a little bit of sensory impairment, maybe in their fingers and toes, and like that's about it. GBS generally burns itself out within 2 weeks. So after, from the onset of symptoms to 2 weeks later, usually by the 2 week mark, that's as bad as it's going to get. And then things will start to recover from there. So unfortunately, and then when we went into the hospital and you got assessed, they were like, "Yeah, we're going to put you on some treatment. Things shouldn't. You're young, you're healthy. Things shouldn't be too bad, and you should be recovering pretty quickly." Unfortunately, my family member had a severe subvariant. So many cases of GBS are fairly, more mild to maybe moderate. Unfortunately, my family member had a severe subvariant called the AMSAN variant. So it's the acute motor and sensory axonal neuropathy. So meaning that the immune system didn't just start attacking the lining of the insulation of the nerves, the myelin sheath, but actually started attacking the nerve body itself. And so basically, my family member just developed very notable. It was quite a rapid progression, and so approximately, I believe it was around a week or so after the onset of symptoms. Unfortunately, their respiratory muscles were compromised because the nerves, they innervate everything in the body. And so at first it was, loss of sensation, loss of motor function, started to become really difficult to like walk and stand. And then unfortunately it starts affecting the respiratory muscles. So the nerves to the diaphragm start getting impacted. And so their ability to breathe was compromised. And so after about a week, the writing on the wall was that um, you're going to need to be intubated. You're going to need to go to the ICU. We're going to need to intubate you. So, tube down the throat because you're not going to be able to breathe for yourself. You're not going to be able to swallow. You can't feed yourself, etc. And that's what happened. And so basically at the peak of it, my family member was completely paralyzed from the neck down. They were still able to nod their head and turn their head, which thank goodness for that, because some people are paralyzed even beyond that. There was partial eye paralysis. So they couldn't close their eyes. There was a lot of eye irritation. Had to keep putting in artificial drops, tears and whatnot. They were intubated. It was just really, really, really extreme and awful, to be perfectly blunt. Um, So at around the 2 week mark, things started to, that's when things stopped progressing at least, but then it was a matter of waiting for recovery. Now, as far as treatment goes for GBS, there are um, depressingly very few treatments at least in the conventional medical system. The two treatments are IVIG, which is intravenous immunoglobulins. So basically, these are pooled antibodies, essentially immunoglobulins from thousands of donors. So when people donate blood or they donate plasma, they basically take the antibodies from the plasma and then they pool like thousands of people's antibodies, and then they run and they purify them, screen it for disease and different things like that, and then they run that intravenously. And the idea is that with GBS, it's an autoimmune condition, and so the immune system is attacking the nerves, and in this case. And so by giving the intravenous infusion of those antibodies, then the idea is that it kind of dilutes down the antibody level in the blood so that there's just not as much opportunity for the nerve attacking antibodies to do as much damage. So it's kind of a dilution method. And when you look at the research literature shows that by giving a daily infusion of intravenous immunoglobulin for 5 days in a row, it does help to reduce the likelihood of it helps to reduce the severity of the outcomes. Now, unfortunately, in my family member's case, um, I would hate to have known what it would have been like if it was more severe than what happened, because it was basically as bad as it could get. With my family member's case, not only was there that paralysis from the neck down, there was also an attack on their autonomic nervous system. So their heart rate was like going over like 200 beats per minute. So they're even with medication, very, very hard to keep that under control. There was like no semblance of body temperature regulation. So I was spending about anywhere from 33 to 50% of every day in the hospital with my family member. We were kind of sharing the 24-hour being with them between my wife and another family member. So we were kind of all sharing that, and um, it would be like middle of the night, freezing cold in the hospital, and my family member had like fans blowing on them, just basically wearing nothing but underwear and just fans blowing, sweating. It's like, oh my gosh, like the nervous system regulation of temperature regulation, heart rate, things like that, just like completely out the window. So just it was a really, really severe case. So with the IVIG that was administered, hopefully it helped to some extent, but it definitely didn't nip things in the bud. And treatment was started maybe 3 days after the onset, maybe 4 days after the onset of symptoms. So it wasn't like, oh, it was, things were already super, super progressed. They had progressed somewhat, but the IVIG definitely didn't nip things in the bud in a really obviously super meaningful way. And maybe it would have been even worse. It had it had not been given. But so there's that treatment, and there's another one called plasmapheresis, which is basically a method where the blood is filtered, and the some of the antibodies are kind of like wiped out of the bloodstream to try to get rid of them that way. The efficacy of those treatments are pretty much equal based on what I saw in the research literature, and those are the two options that are available, and that's pretty much it. Otherwise, it's just wait for the autoimmune reaction to burn out after that 2 week period, and then wait for things to recover and just damage control in the meantime. So. That was where things were at the peak of things. Um, so the next step was to try to, from my perspective at least, was to try to preserve my family members' health as much as possible during this period. Now, unfortunately, my family member was intubated, so basically on a ventilator. Um, Basically, the machine not entirely breathing for my family member, but really significantly helping at first. And then the ventilator, eventually they got weaned off of it. Unfortunately, ventilator acquired pneumonia is a fairly common thing. So my family member got a couple of bouts of pneumonia. So there were lots of like pretty hardcore IV antibiotics that were administered during that time. So one of the things that we worked with was using a probiotic. My family member was being, had an NG tube. At that point, was it an NG tube? Anyways, they basically had a feeding tube, so the probiotics were very easy to administer in there. So we had probiotics going just to try to maintain the health and integrity of the microbiome as much as possible. You don't want to get like a C. difficile or some type of a antibody induced like diarrhea or something like that. And Then we also worked with creatine as well. So none of these things were recommended by the hospital staff, and that's fine. That is, hospitals have their policy. This is what they work with, and that is what it is. What we were very happy with and thankful to see is that the hospital staff was very respectful. They were, respectful of our wishes, and so and we were very respectful as well too. We didn't march in there saying like, this is how it's going to be done. We were very collegial. I mean, we are Canadian after all, so generally quite polite and all of that. As many other people in other countries are too. But it's one of our stereotypes. And so but basically, it was our suggestion to say, okay, let's work with a probiotic. Great, we did that. Let's also bring some creatine into the mix, because one of the things with being stuck in a bed and being unable to move, even for a couple of weeks, let alone what wound up being 4 or 5 months, give or take, before my family member was like no longer an inpatient. Is there's going to be muscle loss. And this is especially important for folks that are of an older demographic. My family member was well under the age of 25, so still very, young, went into this fell into this disease, in good shape, good muscle mass, that kind of thing. And so, especially for someone who's older, especially for someone who was deconditioned in the first place, like very important to try to maintain muscle mass, in my opinion. And so there is some research literature showing that when folks supplement with creatine, it helps to offset the loss of muscle when folks are inactive for whatever reason, like a hospital-induced inactivity, for example. So we brought creatine into the mix, and Then we also made sure that there was lots of protein in the mix as well. Now, the nutritionist or dietitian who was in charge of things like had recommended a high protein diet, which was great. We had requested that they work with um, in my opinion, much healthier meal replacement formula. So a lot of meal replacement formulas, things like, oh my gosh, I always forget the name of it. Oh, the kind of like the meal replacement shakes that people consume. I cannot think of the name off the top of my head. But anyways, the kind of meal replacement formulas that people will sometimes use, or when they're needed, the ones that are oftentimes used, like Ensure. That's one of them. There's another one too. But so like products like Ensure, if you look at the list of ingredients, it's like there's a lot of sugar in there. There's dairy products, and my family member doesn't do the best with dairy products. And we didn't want to have those things being their sole source of nutrition. So thankfully, the hospital had an alternative option. There's a formula called Sperry, Sperri. Sperry is something that is available commercially, and evidently hospitals, at least here in Canada, have it. And so Sperry, it's a pea protein based protein, so not a dairy based protein, which was nice. And then it also didn't have any added sugar in it as well. I can't remember what they used as a sweetener off the top of my head, but I remember reading the labels like, oh, this actually isn't half bad. I mean, I wouldn't want to consume it if I didn't need to, but it's certainly a lot better than an Ensure or Boost. That's the other one. Boost and Ensure. Those are the two that I'm throwing under the bus. So all well and good. If they work for people, that's great, but just it's hurts my brain as a clinician to think like, oh, we're going to put like, um, high fructose corn syrup and things like that into a person who's like recovering in the hospital. It's like we should probably put really healthy stuff into them. But anyways, there's different philosophical thoughts about that. So we're using my family member was getting a high protein intake, and yeah, so the Sperry formula, the creatine, the probiotics. Um, there were a couple of other things we had in the mix. I can't think of them off the top of my head right now, but yeah, there's a couple of other things that were in the mix, but those were some of the kind of key things I wanted to mention. So if heaven forbid if you're listening to this and you or a loved one or someone is in the hospital or in bedridden for whatever period of time, just a couple of things to be aware of about the creatine, the higher protein intake, and then also just remembering about probiotics when we're dealing with antibiotics. So over this time, there were some other supplements that we brought into the mix as well, things to basically try to help support the nervous system as much as possible. So again, like I'm not giving any treatment or medical advice here through this video. This is just relaying what we did. But we were working with fairly high dosages of vitamin B12. So like 5 to 10,000 micrograms per day. Alpha lipoic acid, like R plus alpha lipoic acid, 300 milligrams a couple of times a day. Something called benphthiamine, which is the active form of vitamin B1. 300 milligrams a couple of times a day. Acetyl L-carnitine, 1,500 milligrams a couple of times a day. So we were working with all of these things for my particular family member. And again, these are all things that, should be, get health advice from your healthcare provider. Don't take it from somebody on social media or wherever you're watching this video. But that's what we were working with. One of the other things that we feel was helpful for my son's recovery was working with something called BPC 157. So BPC 157 is a peptide. Peptides are basically small little amino acid chains that can be that are utilized for a variety of different purposes. The BPC 157, so BPC stands for body protection compound. And this is a peptide, a little protein chain that's made in the stomach. And it's something that helps to heal damaged tissue in the body. It's helpful for healing the gastrointestinal tract if it's damaged, but it can also be used to help heal nerves and ligaments and tendons and muscles and different things like that. So with the BPC 157, it's something that we were working with an injectable form of it. It can be taken orally, and it's one of the few peptides that seems to work well if it's taken orally or as an injection. But we just figured, we had the injectable form, we might as well just inject it. So we figured that would maybe work better, even though they seem to be fairly tit for tat when it comes to the that particular one. So that was one that we were working with on a daily basis to help facilitate faster recovery. Um, in the early days of recovery, the hospital was providing physiotherapy care. It was very, very challenging for my family member to do much of anything at first. Paralyzed from the neck down, can't really do much physio. But uh, as things started to improve, over the span of say like, and I'm a little hazy on the exact timeline, but like say within the first week or two after that 2 week mark where things got like, worse and worse and worse and worse and worse, and then hit like a stop point, then within a week or two of that point, there was a bit of muscle recovery that started to occur. Now, as I'm remembering now, one of the other things that we were doing in hospital was doing some electroacupuncture. The hospital was fine with that. I was able to do it myself because I'm a clinician and naturopathic doctor, so I'm able to do that. But they were also very totally fine with us if you want to bring somebody in to do a treatment, that's fine too. So that was something that I felt was a good adjunct, because by doing that electroacupuncture, there is a little bit of research indicating that electroacupuncture and just acupuncture itself is able to actually stimulate nerve growth and recovery. And we're like, hey, anything we can do to tell these nerves to start growing and healing, let's do it. So we were doing those treatments, every couple of days or so. My family member was, being poked and prodded, blood draws, all these different things, like, and just very, very uncomfortable, dealing with a lot of symptoms. It was a very, very, very challenging process. They're an incredibly stoic individual and like weathered the storm very, very well, but it was a lot. So there were just some days where like I just don't want to have more needles stuck into me, even if they're little tiny acupuncture needles. So it wasn't a daily thing, but every other day on average, we were doing an electroacupuncture treatment to the arms and legs just to try to stimulate things as best we could. Um, so after maybe a week or two, when some muscle movement started coming back, then the physiotherapy was coming in pretty much on a daily basis, not on the weekends, unfortunately. So on the weekends, we were doing the physio because again, it just is what it is. I'm not, saying anything disparaging here, but well, here in Canada anyways, where it's a socialized healthcare system, it's like, well, if you don't have physios on staff on the weekend, then nobody's going to do physio. So that's part of the reason that, me and my wife and, another family member were there, one of us there at all times so that we could kind of fill in any gaps that we perceived or any, and again, folks would say like, yeah, like he should be getting physio every day, but we don't have anybody on staff today. So it's not going to happen. Or like, oh, the physio had to call in sick. Well, okay, my family member still needs physio support, so like we're going to provide that. So, so I think the physio was something that was very important for a multitude of reasons, to the um, uh, try to get the muscle strength built back up again, trying to, by doing that physical activity, that's going to stimulate more nerve growth and nerve recovery as well. Kind of if you don't use it, you lose it. And so by using it, it's, bringing that function back, it's going to happen faster. So the physio is really, really important. Once my family member got to the point where they were able to get into a rehab facility instead of being in the ICU. So they kind of downgraded from the ICU to the MCU, I think it was. Oh my gosh, this is a long time ago now, but it's kind of like the medium intensive care unit kind of thing. So it didn't need quite as much, like, it didn't need two nurses on, at all times, just, one nurse covering, multiple beds kind of thing. And then eventually got to just back to the neurology department where there was, much less, need for ongoing active or like, just second by second care kind of thing. The physio became less. The hospital wasn't providing the physio on as regular a basis. There was still regularly scheduled physio, but it wasn't necessarily every single day. Sometimes they were overbooked and couldn't get to my family member, this and that. So we were doing physio together, me and my family member, every single day, doing certain strengthening exercises over and above what the regular physio was doing. Basically just doing, range of motion exercises, resistant range of motion exercises over and above the physio that was provided. But then we also hired private physio to come in every day that the hospital wasn't providing physio, so we could kind of fill in those gaps too. From all the reading that I did, all the reading that I did, everything that made sense to me, it's like, well, this is really, really important. This is what's going to fast track recovery as much as possible. Um, So let's see here. Um, that was I just want to make sure I'm not missing anything from more of like the hospital experience. So I think, okay, I think those are the main things. So, anyways, as far as the kind of course of action went, so again, like when my family member no longer needed to be in the ICU, was then kind of downgraded to the MCU. From there, went to the neurology department. I believe that it was when when my family member got to the neurology department. I believe that's when it was in the MCU that they were no longer intubated so they could breathe on their own. And what was really, really amazing is that the amount of time it took for my family member to become no longer intubated, to get off of the ventilator. My family member really exceeded the doctor's expectations. Like there were certain benchmarks that had to be met. And so my family member was just, very, again, very dedicated, doing everything right, wanted to get out of there as fast as humanly possible. And so hit the targets to the point where the doctor on call said, we said that we would take out the intubation tube today, but like we're gonna give it an extra day because like you're just going too quickly. Like, you're doing too well and we kind of just don't really believe it, which was very frustrating for my family members. Like I'm working really hard and now you're telling me like I'm doing too good of a job, so I have to wait another day with this thing stuck down my throat. But anyways, there was no way to force the hand of the doctor on call. But so just the reason I tell that little anecdote is because I believe that the rate of recovery, like, certainly was no doubt positively influenced by the young age of my family member. However, I also feel like it's likely a testament to some of the additional things that we were doing as well in terms of helping to facilitate recovery. So, whether it was, between the acupuncture, the good nutrition, like the better nutrition, I should say, some of the supplements, that type of thing. My family member was hitting benchmarks a lot faster. Once the intubation tube was removed, then there had to be like some testing done to see like when they'd be able to actually swallow things on their own, like in terms of swallowing solids and liquids and things like that. And they exceeded all those expectations as well. So I think that was very favorable to see. Um, so flash forward to getting out of the hospital. We were very fortunate in that, we have things set up in our life in such a way that we were actually able to bring my family member home to not need to actually stay full time in the rehab center. So the way it typically goes is go from the neurology department, and when there's enough stabilization, basically when the patient is able to start to walk. Well, yeah, I think when they're still in a wheelchair. Anyways, there was a certain benchmark that they had to hit before oh no, that's what it was. So my family member was stuck in the neurology department for an extra 3 or 4 weeks or 2 or 3 weeks because they just didn't have a bed in the rehab center, like the physical rehab center. That's what it was. So anyways, there were certain benchmarks that had to be reached. My family member reached them, and then they had to just wait a little bit longer. But fortunately, we had things rigged up in such a way that we could actually bring my family member home, and then they could stay at home, and then just go in. We just drove them in every day to the rehab center to do their physio and their, aquafit and different things that needed to be done. Occupational therapy to regain, like, tactile function or hand dexterity and different things like that. So what was a bit challenging for us was that, again, like this, the resources that were provided through the healthcare system were, we were thankful for what was there, but there wasn't necessarily physio every day. Sometimes the physio would call in sick, sometimes the physio got double booked, sometimes it just wasn't happening, and then again there was like nothing on the weekends. So we were bringing in private physio, doing our own physio at home. And I really believe that my family member improved as kind of quickly as they did, or improved to the extent that they have, in part because of all of the hard work that they were putting in, all of the like ongoing physio and rehab work we were doing. The reality of it is that I wonder if some of the subpar or slow or subpar outcomes from more severe variants of GBS might have to do with just, quite frankly, like not having diligent enough aftercare. And again, I'm not saying this in a disparaging way at all. I understand that our healthcare system is overburdened. I understand that everyone's just doing their best. But the reality of it is that, as much as everyone that we worked with was, very, For the most part. Some people were a little tough to deal with, to be honest, but for the most part, everyone was like very like caring and empathetic, and like obviously like just wanted the very best outcomes for my family member. Um, the reality of it is that, well, when someone is paralyzed from the neck down, that's a really bad situation. That's severe. Like that's something that needs to be rectified. But when a person gets to the point where they're like, well, they can feed themselves now, they can breathe on their own. Like, sure, they're in a wheelchair, or sure, they're still using like, arm canes, but like they're not dying. They're not at risk of imminent death. They can function well enough as long as they have enough family support. Then now we can really pull back on a lot of those supports. We don't really need to offer as much. And I understand like it's, there's only so many tax dollars to go around. It's a bit more of a damage control system. And so I'm not saying this in a disparaging way, but just that was really the impression that we were left with, that it's like, wow, like, so, okay, you're not dying, and thank goodness for that. And we're really thankful for all the support we had. But like, I don't just want a family member who's, not dying. I want a family member who is, back to their original state of health, or as close to it as humanly possible. So I think that, in my opinion, like one of the big gaps there with the aftercare was just not having like this extremely high emphasis on doing the physical rehab. And I understand that with limited financial resources, there's just only so much physiotherapy to go around. I totally get that. But in my opinion, it would have been nice/useful to have an option to say, okay, like we can teach you how to do this. Like the physio that I was doing with my family member, in the hospital as bonus physio, or at home, was not rocket science. It wasn't like, oh my gosh, like I mean, yes, I'm a clinician. Yes, I'm a naturopathic doctor. I know a lot about human physiology. I work with people's musculoskeletal systems all the time. I'm very, well educated in that regard. But the things I was doing, like I could teach somebody to do that fairly easily. Kind of run through like do these exercises, and that's something that I guess one of the take homes from this video is just trying to convey like what are some of the things that I felt were the most valuable with helping with my family members' recovery. And I think that the heavy emphasis that we had on physio was really important, because quite frankly, if we just did what the medical team told us to do, it was basically show up for your appointments, do physio when you're here, and like that's it. Like there really wasn't any additional recommendation over and above that. And so again, I'm not saying that in a disparaging way, but just saying like that's what I feel is a big gap. And I really don't know if my family member would have be so far progressed, like improved by this point, if there hadn't been all that extra physio that had been done. So the recipe for success, in my opinion, throughout the course of treatment, physio. I think that nerve support treatments like electroacupuncture, some of the B vitamins, some of the things that I mentioned earlier, I think I think are important. I think the peptide injections, I think, were an important thing to bring into the mix. Um, Over and above that, when things got to the point where my family member was out of the hospital, had been discharged from rehab, um, and maybe this is probably around the 6 month mark, give or take, 6 to 7 month mark. One of the things that was so things were really improving a lot, had improved a lot by that point. Um, Maybe like 80-ish%, recovery of like everything from pretty much the waist up. Legs were coming along, but there was basically still virtually very, very, very little foot movement. So there was very little dorsiflexion ability. So try to do this here. So if this is my leg and this is my foot, then dorsiflexion would be bringing my toes up towards my leg, and then plantar flexion would be planting my foot down or bringing it away from my leg, away from the front of my leg. So there was very, very little dorsiflexion, and then there was basically like no plantar flexion to speak of. And so the elephant in the room there was that while we were doing, good physio work with, upper body, lower body, doing, exercises for the quads and the hamstrings and, all the upper body exercises and things like that, there just wasn't as much move there. It's really hard to exercise a body part that can't can't move in the first place or has very, very little movement in the first place. And as much as they were like passive range of motion exercises, like, okay, we're not really engaging the nerves here, not really engaging the muscles. And so with GBS, my understanding is that the recovery occurs over, it can take up to 2 years. Okay. The recovery period can last for 2 years after GBS. And then wherever one is at the 2 year mark is probably as good as it's going to get. Now, I'm sure that there are exceptions to that on either side. Maybe it's plus or minus 6 months. Like I don't know for sure, but that's what we were told. That's my understanding of it. Um, if that being said, some folks could certainly recover faster if they had a more mild variant. So it could take way less than 2 years, but it could, 2 years is kind of that window. And so, when we kind of hit around like, the 6 to 7 month mark, it's like, well, we know there's still time, but like we don't want to just wait around. And so, so two things that we started working with. One was we purchased a vibration plate. So vibration plate therapy is basically where you have a plate, a platform, basically. It's a little platform, maybe, I don't know, 2 feet by 1 feet by 1 foot or something like that. And you stand on it or just place your feet on it, or I guess whatever the affected extremity is, and then it just vibrates. So yeah, it basically just vibrates. And that vibration vibration plate therapy has been shown to help reduce neuropathic pain, so it can reduce symptoms. Now, thankfully, my family member had pain management under pretty good control in the hospital during the recovery period. There were some horrendous issues with pain. Actually, one little note that I'll mention is that my family member was hopped up, like loaded up on every single pain med you could think of for nerve pain, like gabapentin, pregabalin, amitriptyline. I think they said clonidine helps with that sometimes. Like, so every like state of the art nerve pain medication was in place. Unfortunately, as the nerves are recovering, it can be very, very, very painful. And so my family member actually had some of the, didn't really seem to have much relief at all that we could tell from the nerve medications. They may have been helping somewhat in the background, but there was still a lot of pain. Opiates were actually fairly helpful, not fantastic, but fairly helpful. Now that's a bit counterintuitive because normally opiates don't work as well for nerve-based pain, but it seemed to be helping. My family member didn't like being on the opiates, so it wasn't like, I want opiates because I'll, strike while the iron's hot. Not at all. They really did not like them, but it was like one of the things that gave them some relief. But what actually worked the absolute best was THC. That was like the game changer. And we did receive, a fair bit of pushback, just saying like, oh, there's not that much research on it, but it's like, well, if it's working, that's what we're going to do. And so THC actually was like just a real lifesaver from a pain management perspective. So that's just a little tidbit there in terms of the pain management side of things. So thankfully, at the 6 to 7 month mark, when we were looking at vibration plate therapy, pain management wasn't a factor, wasn't needed, but vibration plates can also help to trigger more growth factor release as well. So like, okay, if we can't exercise those foot muscles, then let's get the vibration plate going. So my family member was using a vibration plate, 10 minutes every other day, something like that. So that was something that I think was a useful adjunct. The other thing we brought into the mix, and we don't know for sure, because the challenging thing with GBS and really recovering from any neurological condition that has a certain recovery period where there is like a natural pace of recovery that one would expect. But one thing that we're quite confident of is that my family member saw a lot of benefit working with something called electrical muscle stimulation, or EMS. That's not emergency medical services, but yeah, electrical muscle stimulation. So, and sometimes there's neuro-electrical muscle stimulation, or NEMS. So EMS was something that I was spending lots and lots of time trying to find like anything that we could work with to help facilitate recovery, and because we wanted and still want a full recovery. Just to say, I haven't mentioned this yet, but my family member is like markedly improved, like I would say 90% back to baseline. There is still some foot weakness. My family member still needs to use ankle braces, like AFOs as they're called. But like there's just steady improvement still happening with foot function, and really like everything besides the feet is like pretty much back to normal. Stamina is still not quite 100% back to normal, but like they're working 40-hour week at their job. But it's like feels pretty done by the end of a 40-hour week, which is pretty good. I mean, we should stop at a 40-hour week. Just there's a streak of workaholism in the family. So yeah, some of us work like 60 plus hours a week. And so anyways, not quite back to the workaholism level, but doing really, really well. Um, so with the electrical muscle stimulation, that is a treatment that involves, it's kind of like sort of like a TENS machine in a way, in that it involves putting little pads, like little electrodes on over top of certain muscle groups, and then running these electrical currents that will stimulate the muscle to contract, and then the stimulation goes away so the muscle can relax and then contract and relax. So what my family member would do, so we worked with a physiotherapist, and who's trained in this. It was quite challenging to find someone who knew about this. Like I did an online training course in it to learn about it. You know, we bought the EMS machine. They're not expensive, thankfully. Like around maybe $100 or something like that. So not too expensive. They're about the same price as a TENS machine. Some TENS machines actually double as an EMS machine, just as a point of interest. So we found a physiotherapist who knew about this, but it's really I wanted to find someone who had experience with this and not just try to MacGyver it myself. And so I was thankful for that because he gave us some really, really good guidance. But basically, so if we, again, here's my, here's my leg here, we'll say. So for working on the uh, dorsiflexion. So an electrode was placed at the top of the tibialis anterior muscle and then lower down on the tibialis anterior muscle. And then what my family member would do was have a strap attached to the bottom of their foot. And then whenever the EMS was stimulating the muscle contraction, my family member would then pull on the band to sort of mimic that muscle contraction, hold it until it relaxed, and then they would release it, and then it'd be pull and relax. And what's interesting and kind of gets like ever so slightly esoteric and kind of a, I don't know, mind body medicine kind of way is not only should you, when doing the EMS, not only was my family member instructed to pull to replicate that muscle contraction while the contraction stimulation was on, but then also just to think about the body part actually doing that work as well. So kind of trying to reestablish that mind body connection as well. And my family member found that that part of it seemed actually to be quite helpful. So it seemed to augment things. So what was really exciting was that within maybe a month or so of that, the amount of gains with the dorsiflexion had really, really significantly improved, which was awesome. So then started doing the same thing with plantar flexion as well. And then again, like a month or so later, that started to really improve. And then even without doing any specific work for with the EMS on this, then toe function started to come back, which was very exciting. So, we kind of went from, a couple of months previous to having really very negligible movement from the ankle down or below the level of from the ankle down to actually seeing movement in all those parts. And we're like, okay, if we have even a little bit of movement anywhere, then at least we know there's some, nervous system innervation happening there. Like these nerves are not dead. So it was very, very, very exciting. Many tears were shed, happy tears. It was very, very good. And so the EMS I think is a really, really, really valuable tool. I'm very thankful to one of the physiotherapists who we actually had a couple of really, really great physiotherapists, but one of them she answered a bunch of my questions about EMS. She's like, "Oh yeah, we learned about that in school, and we don't use it, but I learned about it." And so she gave me a copy of her school notes that she looked up, which was really nice. So that was nice to kind of cross reference and all of that. So it just again something where I really wish for other people suffering with similar maladies, and EMS doesn't just apply to folks with GBS, which thank goodness is very rare, especially the severe variants, very rare. But it can apply to folks who have other nerve injuries, people who've had strokes. It applies to other conditions too, and it's something where it's cheap, it's fairly easy, and I think really the big obstacle is that it's just not part of the algorithm, so they just don't do it. There is research on it. There's maybe not enough research to say oh yes, this is definitely worth our tax dollars. But man, oh man, on an individual basis, it's I am so thankful for EMS, and I'm so thankful for the physio that we found who was doing it, showed us how to use it ideally, because I really wonder if my family member would have be as far along without that, because again, if you don't use it, you lose it. And with the EMS, where it's artificially stimulating that muscle contraction, it's stimulating those nerves when the brain and the body just can't do it on its own. It's kind of okay, we're gonna help you to do this. It's like if I don't know someone. Sprains their ankle out in the middle of the wilderness and they're with their hiking buddy, it's like they might not be able to hobble back to their the parking lot to like call for help, but if they have their buddy there to like hold on to them and walk them out, like you need that support. So sometimes I think I kind of look at the EMS as being that support buddy helping to walk the injured person out of the wilderness, so to speak, kind of walking the injured nerve out of its depleted state, if you will. So the EMS was something that I think was really, really important. I think the vibration plate therapy was useful. The one very last thing that I'll mention here before I wind things down is so one of the things that my family member also opted to do is we went down to the States and they got some stem cells. So making really good recovery. This is probably around like maybe the 10-month mark or so, give or take. And so we had, I had done a lot of looking around. So yeah, so one thing related to this is that after maybe 3 or 4 months into the journey, when there was quite a bit of recovery, recovery to the point where like no longer intubated, able to feed themselves, able to swallow, like not having a NG tube anymore, all of that. I started looking to see, okay, where can we get some advice from someone to point us in the right direction for how we can optimize recovery? Because again, like nothing against any of the staff that we were working with, but like the neurology department would come in and check on my family member from every well, at first it was like every day or two, and then it was once a week. And anyways, it was, at first we were like, okay, it's like, what else can we do? I'm like, nothing. It's like, well, can we do another round of IVIG? No, the research says it doesn't really help, and sometimes it harms. Okay, can we do plasmapheresis instead of IVIG? Or like now that we did IVIG, no, research says it doesn't help, can harm. Is there anything we can do? No, we just wait. And it's like, okay, that's pretty anticlimactic. It's like, just wait. It's like, yes, we know there's going to be recovery, but like, we want to like optimize recovery. What can we do? And like zero recommendations whatsoever, aside from the physio and occupational therapy, which again, great, augmented that, blah, blah, blah. Oh, but I was like, okay, I'll find anybody in the world to help. I want to pick their brain. I want to talk to an expert who knows about how to, augment the recovery from this condition. And, so I put out feelers to like, naturopathic doctor colleagues, medical doctor colleagues, folks who, are know people that run, private clinics in, Mexico and Europe and like places all around the world, like where they do stem cells and various therapies. And I could not find a single person. It was like, again, nothing disparaging against anyone, but, like when we would get a reply from someplace, be like, oh yeah, we talked to our medical director and they're wondering, has your family member tried IVIG or plasmapheresis? It's like, okay, so we already explained that, they're already, this is maybe like around the 6 to 7 month mark, give or take. It's like, yeah, they're out of the hospital, they're recovering. We're just trying to like facilitate nerve recovery. Like we want to facilitate healing. And like when I hear a reply like that, I think probably what happened was somebody's like, oh yeah, GBS. I remember answering a multiple choice question on that in my medical board exams. Better look that up. Oh yeah, IVIG, plasmapheresis, like, and I understand, like, if you're just hearing an inquiry from someone, you're not going to spend, hours and hours to research something necessarily, I suppose. But it's like clearly the person, if you say that, it's like, oh yeah, I've been out of the hospital for 6, 7 months. You don't need IVIG or plasmapheresis at that point. And clearly you just aren't really familiar with this, and that's fine. Just say you don't know, that's fine. But when we hear that response, is like, okay, they don't know what we're talking about, and that's fine. GBS is very rare, totally get it. But that was like a very frustrating, like almost comically, almost comical, and how like it was so predictable. It's like, oh yeah, like they're asking about IVIG and plasmapheresis. I guess they don't know what we're talking about. That's fine. So I could not seem to find any clinics that specialized in this or that had any experience with helping with this kind of stage of the recovery. And so, there were clinics that said like, yeah, like we can do stem cells on an experimental basis. And again, I wasn't just looking for stem cells. I was like, anybody who could just advise on this. I could not find anybody. I went on, GBS Facebook groups and things like that. And, I'd look for threads, spending hours and hours, like looking through threads, seeing like, has anybody found a good doctor and this and that? And like, there were, lists of clinics, but again, like these are clinics that are kind of, I guess, working more with the damage control in the early days of GBS, which is very important. But like, what about the full recovery? What about the post recovery? And so, with some of these clinics that offer stem cells, excuse me, talking too much here. With some of the clinics that were offering stem cells, they'd say like, yeah, we have no experience. Like we've never treated anyone with GBS. Like really? Like that's crazy. Like some of these clinics, like the Riordan Clinic down in Panama, like they've been around for a long time. Like really nobody with GBS. And so we had some discovery calls with them and they were saying like, we can do this on an experimental basis. We can't make you any promises. We have no idea if it'll help. And we're like, okay, fair enough. Like that's your honest answer. That's fine. So we just couldn't find anyone that had any experience with this. So we did wind up trying, my family member did wind up trying some stem cells down in the States. That was a couple of months ago. It's really hard to tell whether it's made a big difference or not. There has been ongoing improvement, but what we found historically was that as a muscle group started getting better, like as a neuromuscular group, kind of complex started getting better, then that muscle group could be used more and more in day-to-day life. And so the rate of improvement would pick up anyways. And so where thankfully things had already been moving in the right direction with the plantar flexion, dorsiflexion, and the toes, we're just not really sure like if the stem cells made an additional difference or not. So we're really not too sure. I know in some of the Facebook groups there were different threads where people were asking about stem cells and it didn't seem like anybody had actually tried them. Like, oh, if you try them, like, let us know how it goes. And so I just don't really know. So really, really hard to find any data about that at all. So the product we wound up working with, in my opinion, or that my family member wound up working with, in my opinion, is a very, very good product. I talked to the rep, an amazing rep, really went to the ends of the earth for us. So I'm very, very happy with them. So very, very comfortable with them. Um, should stem cells ever be allowed in Canada, like I will absolutely use that company because I think they're fantastic. So I have no questions about like the product, but just the question we kind of went into the treatment with was, are we already maximizing everything between EMS, between exercise, between peptides, between vibration plate, between supplements, between just rate of recovery that's happening anyways? Are we already maximizing the rate of improvement? It's sort of like if your car can drive a maximum of 150 kilometers per hour, it's like if you push the gas pedal all the way through the floor, it's still going to go 150 kilometers per hour. So are we already going 150 kilometers per hour in the healing direction? That was kind of the question mark, and we just don't know. So my family member feels that the stem cells were probably helpful in some capacity, but definitely like not like I'm recovering twice as fast or like 50% as fast. It's like I'm kind of getting the impression it's like if anything, maybe it's like a 20 to 25% faster rate of recovery. It would have certainly been interesting to bring them in sooner into the game. And quite frankly, with the stem cells, like they should ideally be administered like maybe, once a month or every couple of weeks, like for a little while, just to like really maximize them. But they're very expensive, very cumbersome, traveling like across the continent to get those. So it's not something that we're likely going to play with more at this point. But I did want to mention that because I know that there are questions about that. So I think that I've got my little short list here of things I wanted to make sure I talked about. So I really wanted to mention the physio, really wanted to mention the EMS, and yeah, of course, mention a lot of the other tidbits along there too. So if you or a loved one or a friend or someone whatever, is dealing with GBS, especially if it was a more severe subvariant, my heart really goes out to you. I was right there in the passenger seat the whole way, and my God, it just seems like a lifetime ago, even though it was just a little over a year ago now. And it was just the most insane experience of my life. I remember I had multiple times where I said to myself, like, I can't believe this is my life right now. I can't believe this is happening. This is just insane. Perfectly healthy young person is like paralyzed from the neck down. It's like, man, it's unfathomable. However, I really wanted to make this video because I wanted to share just my experience and by proxy, like on behalf of my family member, share their experience because yeah, hopefully this is helpful in some way, shape, or form if you're dealing with this condition or a related condition. If you have any questions about this, you are very welcome to, post a comment on the social media site where you're watching this, or DM me on Facebook, or email my clinic or whatever, you certainly feel free to reach out. And I can't provide medical advice for anyone who's not a patient of mine, but like if you have a question or I can help out in some way, like please don't hesitate to reach out. Because man, oh man, like I just, I would have paid a very, very hefty sum. I was prepared to pay a very hefty sum to be able to just have like some contact point of someone who like some clinician who like knew about this stuff, like who had some, information to share. And so, if I can, yeah, be of some help or point you in the right direction or give some guidance, I'm really happy to do that. My family member is also like happy to, really wants to, again, have as much good from this challenging experience come from it as possible. So if they can help in some way, like, yeah, we both have that as a goal. So anyways, feel free to reach out, or yeah, contact me in some way, shape or form if you have questions. And yeah, I'll leave it there for now. So thanks for your attention today.